Hi everyone, today is the session of the occipital bone, the very important bone which forms the posterior aspect, you see, the our skull. And you will see when you lie down over the bed, it will touches this pillow. Now, how this bone, what are the different parts of the bone and how will you hold it in anatomical position? Now the parts of the bone it has got a expanded squamous part, it has got a pointed basilar part, quadrilateral not pointed, and it has got two lateral parts. Now the squamous part has got the two surfaces, the external surface which is rough, the internal surface which has got the different fossa, you will see. Now I discuss the external surface. You will see in the external surface there are a protuberance which you can feel in your own skull also, and this protuberance is known as external occipital protuberance, and from this protuberance a line it descends downwards in a big foramen which is present in this occipital bone, and this foramen is known as the foramen magnum. The large foramen through which the main structure passes, that is the lower part of the medulla. Next, the external surface, you will see this squamous part has got the convex external surface and concave internal surface. Now in this convex surface, from the external occipital protuberance, three pairs of lines radiate towards the lateral angle of this bone. What are the angles? You will see in the squamous part, you will see a superior angle directed above, articulates with the parietal bone, forms the lambda, two lateral angle, articulates with the mastoid part of the temporal bone. So these are the three angles and the four borders of the squamous part of the occipital bone. Now you will see the borders are, this border is known as the parietal border which forms the lambdoid suture. This is known as the mastoid border or inferior border which articulates with the squamous part and the mastoid part of the temporal bone. You will see from the external occipital protuberance a crest descend, and this crest is known as the external occipital crest, and in this crest if you flex your neck you will see a ligament is attached. What is the name of that ligament? If you see this ligament, you will see that is a very tough ligament in your back when you flex your head. So this is known as the ligamentum nuchae. Nuchae means neck. Next you will see the important line, that is the superior nuchal line. There is also another prominent line, and that is known as the highest nuchal line. Now the superior nuchal line, it is very much prominent, and in the superior nuchal line two important muscles are attached, and these muscles, if I tell you that I make it attachment of a marker, you will see the color which is attached here, that is the pink color, it represents the origin of the trapezius muscle. The trapezium sepate extensive muscle which is very important in the neck stiffness. Next you will see in the lateral part of this border there is gives insertion. If you forget the insertion or origin, then you will say the attachment, because the attachment is the ideal term. You cannot get this color when you will see the muscle. Only because of the beginner we will paste this muscle colored here. So if you forget, then you will tell the attachment of the trapezius, and laterally, and below there is the attachment of the sternocleidomastoid. You can see when you rotate your head towards the lateral side, the muscle prominence, big muscle, that is the sternocleidomastoid. And you will see, so this is the external occipital protuberance and the superior nuchal line. Next you will see here, below and parallelly there is about 2 cm below there are another nuchal line that is known as the inferior nuchal line. Between the superior nuchal line and the inferior nuchal line there is attachment of the muscle. They are the recti muscle and the oblique muscle. You will see, we will move our joint, that is the nodding movement. You will say the yes or no, there is the movement. So this muscle regulates this. So this is the inferior nuchal line. So this finishes at the squamous part of the occipital bone. You will see in this squamous part, above the highest nuchal line there is a smooth area, and this smooth area is related to the gallia aponeurotica, or which is known as the epicranial aponeurosis. Next is the inner surface of the squamous part of the occipital bone. You look at, if I hold it in anatomical position, that you will see the posterior rough surface will be directed backwards, the foramen magnum must be vertical, the basi-occiput is directed to the basis sphenoid and it fuses with the basis sphenoid, forming a slope. We will see here there is the slope, and this slope is known as the clivus. And in this slope, the brain stem, that means the midbrain, pons and medulla, it lies on this slope. Next you will see that here the internal surface is marked by 3 groups, and these groups are known as the sinuses. What does the sinus means? That is the dural venous sinuses. There are 2 dural venous sinuses here, the 2 transverse sinus. I will mark one transverse sinus with the blue color, and another you will see transverse sulcus which lodges the transverse sinus. You will see this transverse sinus, it is more deep. So it is the continuation of another sinus which is situated at the tip, and this tip is occupied by the superior sagittal sinus. So this superior sagittal sinus, 2 sinuses here, they form an area which is known as confluences of sinuses. So here is the confluence of sinuses. Now below that you will get another line, and that is known as the internal occipital crest. And this internal occipital crest, you will see this is the internal occipital crest. And if we see when there is the dissection, you will see the falx cerebelli, that is the process of the dura mater is attached here, and that is, you see, lodges the occipital sinus. What is that? That is the occipital sinus. Just now I will show you the occipital sinuses within a short time. You will see this is the one sinus, this is the occipital sinus. It descends downwards, so it has got an Y-shaped branch in the lower part. So you will see here, just the clay touches my hand, you will see this is the position of the occipital sinus. So you will see this is the inner aspect of the squamous part of the occipital bone. Now it divides it into 4 fossae, and these 4 fossae, the upper one is the triangular. This triangular fossae, it lodges the occipital pole of the brain. You will see, and this forms the occipital form the major part of the posterior cranial fossa. Next is that there is quadrilateral fossa. This quadrilateral fossa, you see, this is the model of the brain, this is the real occipital bone, and you will see this cerebellum, it lodges within this. So you will see the cerebellum is lodges in this quadrilateral fossa. So you will see there is you will see the squamous part of the occipital bone, and you will the inner part you will see. Next you will see the basilar part of the occipital bone. Now the basilar part, it projects forwards and upwards, and if you look it, this basilar part, it actually fuses with the sphenoid bone, forming the basis sphenoid, or that is known with the basis sphenoid, it forms the clivus or slope. Next thing is that the lateral part or the condylar part. Now in the lateral part, this bone is divided into two. There are two occipital condyles here, and here you will see the occipital condyles. Now these occipital condyles, it will articulate with the first cervical vertebra, which is known as atlas, which actually supports the occipital bone or the globe of our head. So what are the movements taking place here? That is the flexion, extension and side to side movement of the neck. Now how will you hold the bone in anatomical position? That means that is the position which you will stand erect and your palm is facing in front. And in this position, that is your position, this is the position where you should place this foramen magnum vertically placed. And you should see that the basilar part of the occipital bone, it should be directed forwards and upwards. So this is how you should hold the bone in anatomical position. Thank you.